Welcome to the Demmi Educational DVD. This DVD is intended to give you an overview of the De Morton Mobility Index, or otherwise known as the Demmi. It has been well established that poorer physical ability is associated with a range of poor health outcomes for older people. These include, but are not limited to, an increased risk of transferring people to nursing homes, greater carer burden, fall, mortality, and healthcare costs. So quite clearly, the physical ability of older people is a very important indicator of their health. Just as we have other important indicators of health, such as a blood pressure test for measuring blood pressure, we also require an accurate mobility test that can measure the mobility of all older people across all clinical settings. This is what led to the development of the Demmi. The Demmi is the first mobility instrument that can accurately measure and monitor changes in mobility across settings for all older adults. Some of the key features of the Demmi are that it consists of 15 mobility items that range from bed-bound activities up to high levels of independent mobility. It's administered by observation of physical performance, and the person is scored on their first attempt on each item. The Demmi has minimal equipment requirements. It only requires a pen, chair, stopwatch, and a bed or plinth for testing a patient on. It can be administered at a patient's bedside, and no specialised equipment is required, eliminating any need to transport the patient to another location. The Demmi assessment sheet is only one double-sided page, which can be easily inserted into the patient's medical history. The 15 mobility items that make up the Demmi are in a hierarchy of difficulty from easiest to hardest. The easiest item is sitting unsupported, and the hardest item is tandem standing with eyes closed. Most of the items are commonly tested in normal everyday physical assessment, and all items can be quickly tested at the patient's bedside. The Demmi has a score range from 0 to 100, where 0 represents very limited mobility and 100 represents independence in mobility. The Demmi is without floor or ceiling effect, meaning that it isn't limited by a large proportion of patients scoring at the bottom or top end of the scale. The Demmi is quick to administer. It takes, on average, just under 9 minutes in an older acute medical population. The Demmi fits the RASH model, which has 3 key implications. Firstly, it means we have a hierarchy of difficulty from easiest to hardest. Secondly, it tells us that the Demmi is a unidimensional measure of mobility. That is, it is measuring just one construct, being mobility, and doesn't include items that measure other constructs, such as continence or speech, for example. Thirdly, the Demmi provides interval level data. Many measurement tools in health provide ordinal level measurement. This diagram shows us that on an ordinal level measurement tool, change scores are not necessarily consistent across the scale spectrum. For example, a change score from 20 to 40 may not reflect the same amount of change in the underlying construct of interest as a change from 80 to 100. Interval level measurement tells us change scores are constant across the scale spectrum, such as on a blood pressure cuff or thermometer. A change from 0 to 20 at one end of the scale represents the same amount of change in the underlying construct as a 20-point change at the other end of the scale. All measurement tools have error. For the Demmi, the MDC90, or the reliability, has been found to be 9 points. This tells us that a change score of 9 points or more is likely to have overcome measurement error and to reflect a true change in patient mobility. The minimal clinically important difference has been found to be 10 points for the Demmi. This tells us that a change of 10 points or more is likely to represent a clinically important change in mobility for patients. The Demmi was initially developed in the acute hospital setting. It has since been validated in a range of populations in hospital and community settings. It has been found to have predictive utility for falls and can be administered by a range of healthcare professionals. The Demmi is to mobility as a blood pressure cuff is to measuring blood pressure. Given the ageing population and the importance of maintaining physical independence in older age, there has never been a greater need for the Demmi. For further information on the De Morton Mobility Index, please visit www.demmi.org.au.